Tell us a little bit about yourself and why you wrote your book.
Well, in college, I got a degree in neuroscience, and then I went to medical school. I took 4 years off in the middle of medical school, got a PhD in philosophy, and then after I finished medical school, did an internship in family medicine, residency in psychiatry, and then I've been at the University of Washington for 30 years on the faculty, where I've worked kind of at the margin of physical health and mental health care. With the book, I wanted to bring forward some ideas that I'd worked on in my dissertation, kind of viewing them through the lens of the 30 years of clinical care that I've done since that time. I wanted to take on a topic that was bigger than I could address in any single medical journal article.
So could you tell us briefly what the book is about?
Yes, sure. The book is about how we need to expand the role of patients in the production of health. Patient participation in health and health care can be much broader than we have done up to this time. The word patient has meant passive from the moment it was introduced into Latin. And passivity is an adequate model for patient participation in acute illness care, but not chronic illness care. The only domain of patient activity that we've protected is informed consent or choice of treatments. And while this is an important protection, particularly for really ill hospitalized patients, it's just not an adequate understanding of the ways that patients can participate in chronic illness care. Patients need to be the ones who are perceiving whether they're healthy, how and why their health is compromised. For the health behaviors and lifestyle changes that are necessary in chronic illness care, they have to take these into their lives and make them their own if they're going to be effective managers of chronic illness. And even more basic than the patient autonomy that is behind the capacity to make treatment decisions is the biological autonomy that allows all organisms to be active with respect to their environment. So each organism, when healthy, has the capacity to carve their own environmental niche. It's the organism who decides which is predator and which is prey, which is food, which is a mate. And organisms lose that capacity when they're not healthy. It is only by clearly understanding the nature of health that we're going to be able to effectively reform healthcare and health assurance.
And who is the audience for your book?
Anybody who's interested in thinking seriously about health and healthcare and the need to change these in a basic way. Clinicians, policymakers, bioethicists, anyone who is convinced that we've been thinking about healthcare reform in too shallow a manner so far.
And why is the patient as agent relevant now, or what makes it timely?
It is relevant because chronic illness is the unsolved problem in 21st century medicine. Currently, we spend 84% of our healthcare spending on chronic illness care. That's 84% of $1.7 trillion in the US. And despite spending all this money, we are falling behind peer countries in our health status. We are getting a poor value for our healthcare dollar. We need to think about the relationship between health and healthcare more deeply if we're going to solve this problem.
Right now, Congress is debating on how to replace the Affordable Care Act. Does your book offer any perspective on this issue?
Yes, the Affordable Care Act is basically about expanding access to insurance. And my book argues that we need to be thinking more deeply about how health and healthcare are related to each other if we're going to improve the value of healthcare and improve the health status of our country. The book argues that we must recognize the patient as the primary perceiver and producer of healthcare. Once we recognize this, then the policy choices and options will become much clearer.
Agent is an unusual word to have in a title. Why did you choose that word?
I got the word from Aristotle's physics. In his physics, Aristotle explains how things change. He opposes patients who undergo change to agents who cause change. Aristotle did not think that any one thing or anyone could be both a patient and an agent, but I do. In fact, we need to rediscover the agency that lies within patients. Only if we do that will we be able to muster all the resources that we need for chronic illness care. I argue that patients are the primary means, patient agency is the primary means by which health is achieved and is the primary nature of the health itself.
I see you have a picture of a woman descending the stairs on the cover of your book. Why did you select that cover?
That picture is an adaptation of a famous painting called Nude Descending a Staircase by Marcel Duchamp. I wanted to depict a patient in motion because I believe it's important for us to understand patients as self-moving and self-healing beings. So just as biological science has trouble explaining how something can be self-moving, scientific medicine has had trouble explaining how anyone can be self-healing. I think the roots of the problems in explaining both action and health are the same and need to be solved for our health and healthcare project to go forward.
You've published a lot about the opioid epidemic in the past decade. Is there anything about that in your book?
Yes, I use opioid treatment of chronic pain as an example where chronic illness care has gone awry. I argue that the objective model of chronic illness care, where we focus on repairing the broken part, has failed. I also argue that the subjective model, where we try to drive down pain scores, usually through opioids, has also failed. Like in the rest of chronic illness care, with chronic pain, I think we need to focus on restoration of the capacity for meaningful action as the focus. And in fact, I define health as the capacity for meaningful action.
And finally, what effect do you hope that this book will have?
I hope that people will think about health differently. Health does not come from healthcare, and health cannot be seen on an MRI scan or in a blood test. Health arises from patients living actively in their communities. And in fact, health is expressed as patients living actively in their communities. That is the insight I hope that people achieve. Thanks for watching this video. I hope that you will find the book interesting. I'm happy to correspond with anyone who has a comment through my website. Thank you very much.